Since 1983, FAME has helped business and education work for Maine. Contact the Authority, the Finance Authority of Maine.
Welcome. This is our Afterthoughts segment where we keep our guest around from our broadcast show for a little extra conversation and hopefully some more candid discussion that you can only see on the web. Here with us today is Michelle Hood, President and CEO of the Eastern Maine Healthcare System, and she is also the Business Leader of the Year award winner for Mainebiz for 2010 for the large business category. Once again, congratulations.
Thank you.
It's great to have you here. One of the things you talked about in the show was, and we didn't get to go spend time on it, was how important, we were talking about Maine and what is different, you know, how's it similar being in Maine to other states, et cetera. And you mentioned the impact of working with the legislature, and you talked about Maine Care in particular.
Right. Talk
Talk more about that and how that's affecting Eastern Maine healthcare systems, and what do you think is going to happen with all that? How's it going?
Well, you know, I think that the challenge with the Maine Care population is that in most states it averages somewhere around 12 or 13% of the population that's
And just so everybody knows, Maine Care is Medicaid in Maine.
Right.
Okay. Just make sure.
Maine Care is Medicaid.
Yep.
And in Maine, you know, we're pushing into the mid-20 percentile range of coverage for the population. And the challenge with that is that typically Maine Care Medicaid it does not pay the full freight of the services. It's a negotiated fee schedule, and it typically runs, you know, somewhere in the high 70 cents on the dollar range of actual cost. Some would say, well, that's the problem for providers because they just need to manage their costs more effectively. But our costs are largely driven by the health of the population that we serve. And in Maine, you may not know, but we have a high per capita utilization of healthcare services because we have a high percentage of our population that is struggling with chronic diseases. And so our health status is in the state is not where it needs to be, and so utilization goes up along with that. So,
is it the same statewide or different regions?
Different regions have different health. We do a community health needs assessment every 3 years, and we definitely see some differences in the different geographic areas. Some areas of our state tend to struggle more with smoking and with weight control issues. Others have high incidence rates of cancer in comparison to their state neighbors and so forth. So we've got those challenges, and we've got also the challenge of the way that the state has designed the Medicaid program in Maine. It is one of the top 5 richest programs. So every state can control what they cover under their Maine Medicaid program. And Maine has chosen over the years to be very generous. And as a result, again, the utilization goes up, and services, the scope of services that an individual can access goes up.
Right, it was interesting. You also mentioned kind of how responsive is our policymakers to healthcare CEOs like you, and not just big providers like you, but others that are, I mean, can you get their ear in Augusta, and do they understand?
Yes, we can get their ear. It depends upon the time of the year and if the legislative group is in the lawmaking mode or if they're in the learning mode. But we do have a good relationship with both parties' leadership and committee leadership, and with the policy office in the executive branch, and with the governor's office. He has been a strong supporter for healthcare.
He clearly has been committed to trying to figure out not only healthcare but also how do we get that Medicaid thing cleared up.
Absolutely.
You know, what a tremendous mess they've got to deal with.
Absolutely.
Just the larger budget in general.
Yes, and then we have to be worried about what's going to happen in Washington, D.C.
Let's talk about that.
And how that's going to impact our state program.
Given what you know of it now and how it may turn out, how do you think it will impact Maine and your system in particular?
I think that there's so much that has not been specified that we won't know. We won't know a lot of the impact areas for many, many months and probably a couple of years. As you know, that most of the impact on actually the access through changes in insurance products and so forth aren't scheduled to even come into play until 2014, 2015, 2016, even some provisions of the bill.
How are you guys even planning? I mean, even once it's passed, like you say, those are phased in over the next, whatever, 4 or 5 years. A lot can happen in 4 or
Right.
5 years, as we know. How do you plan around that?
Well, I think there's one given, and that is that the Medicare program and the Medicaid programs at the state level
Yep.
can't afford to spend any greater percentage of their state or the federal budget on health care than they currently are spending. So we know that in order to be successful in the future, we're going to have to be we're going to drive cost out of our delivery systems. And
What are some key ways you'd do that? What are you guys looking at?
Use of technology
Yeah.
is a big one, and that's
For distance kinds of things
Di-
and medical,
Yep.
electronic medical records?
Yeah, telemedicine, home care services
Yep.
where we can do remote monitoring
Really?
of patients with chronic diseases, using specialists from one location and beaming them in, if you will, to a primary care office in a remote area of the state. And so you've got that ability to utilize the expertise but not have to duplicate the
Right.
expertise.
Right.
Our intensive care units across the state right now are increasingly getting hooked up to one of the tertiary centers. So Eastern Maine Medical Center is remotely monitoring intensive care level patients in several hospitals around the state, as does Maine
Right,
Med
right.
monitor patients not in their intensive care units.
As both of those systems,
Yeah.
yours and Mainebiz,
Yeah.
as you continue to grow, will it become more centralized? Is that, will the smaller kind of rural community health provider things have to?
I don't like the word centralized, but
what word?
consolidated.
Okay.
Consolidated,
What's the difference?
yes. Well, the difference in my mind is that
Because those rural communities they're fearful of that.
they are,
Okay.
and we don't want to remove healthcare from the local communities because, first of all, healthcare is local, and people heal better when they're near their homes and when they're near their families. Healthcare is a huge economic driver in our small communities, and
It's usually the largest employer.
right, and so stripping it out of the communities has impact in many, many ways. So when I say consolidated or coordinated versus centralized, I mean that we can identify an expertise area from our hospital in Presque Isle and apply it to people getting services throughout our geographic area.
Speaking of kind of those local hospitals, I did want to ask about the Down East
Yep.
Community Hospital in Machias, and how did you turn that around, and also when you haven't been here that long, and you decided to take that on. Why did you take that on?
Well, I got that phone call, from the state and from the Department of Health and Human Services, and they said, we've really got a situation in Machias that is critical, and that hospital's looking at losing its capability, its ability to take care of Medicare and Medicaid patients because it's not fulfilling the conditions of participation in those programs. We've tried everything we can think of in order to move them along the path that needs to be taken in order to reestablish the quality of the clinical care that's being provided. And we can't solve the problem, and we are going to petition the court for emergency receivership.
Right.
And would you consider being the emergency receiver? And that was the last week of June last year. And I says, well, my first reaction is yes, we will do that. But I said, let me sleep on it.
Right.
And I hung up the phone and I called my board chair and I said, here's what's happening. And I said, help me think through it from the governance perspective. Because part of the receivership model is that they basically suspend the board and all of the typical decisions that are resident in the board structure comes to the receiver. So George Eaton is my board chair, and we talked about it a couple times over the next 12 hours or so, and it really came down to the fact is if our mission is to provide access to quality health care, closing a hospital in Washington County doesn't do that.
Thank you for coming in. Congratulations
Thank
again.
you.
We'll probably have you back, as I do want to try to get major healthcare providers back again
Sure.
to just have that larger discussion once we know where the federal government's going,
Right.
and then we can see how that impacts Maine.
Be glad to.
Thanks again.
Thank you.
Thank you all.